Ladies and gentlemen, I just want to take you through our story of how we arrived to where we are. We arrived to where we are today. So this is more like a story which I want to just relate to you. Probably this story may inspire other colleagues in Africa where there is no fetal medicine if you listen to our story. So to begin with, let me say this is our background to say 3 years ago, we didn't have fetal medicine services in our country, and there was minimal to no antenatal scanning done in tertiary hospitals. Very little would be done. The majority of patients would be referred to private scanning facilities around town. So that even at 2 a.m., I remember as a registrar, at some point at 2 a.m., a woman would come without a fetal heart, and you would ask the woman to go outside of the hospital to just go and have a scan to confirm viability. There was no clear protocol for managing abnormal scan findings, and there was no training platform for obstetric scans. While obstetric scans were a mandatory requirement for OBGYN registrars, but there was no platform for those registrars to acquire the skills required by their logbook. And there was also limited to no scanning at the district and provincial centers. That is 3 years ago. Now, the beginning, after finishing my training in obstetrics and gynecology, of course, I had a year in France. That's where I happened to attend the World Congress, which was in Nice during my time in France as an exchange student there, where I was doing a diploma in obstetrics and gynecology at Lyon University. Then when I came back, after being inspired by this man, Professor Cladious, I came back, sat down on my computer, and I applied for this fellowship and say, I think this is the right thing to do, because that's where my passion had been stolen when I went for the World Congress. So December 2016, I went to London, and here I am now, ready to start my fellowship. And these guys were observers. A doctor from a fetal medicine fellow from Ethiopia, we had just come to observe what Professor Cladious was doing, and another doctor from China, she had just come to observe. Just my 2 weeks while waiting to start my fellowship, while my paperwork was being done, really inspired me. I could see people from everywhere throughout the world just coming, not to do the fellowship like I had come to do, but to observe Professor Cladious do his work. And from that moment, I got inspired. I said, look, if people would travel miles and miles to just observe, how grateful should I be that I've come here to learn under the man's feet. So this was the inspiration to say, look, this is a great opportunity. Let me use it. So after finishing my fellowship, I talked to my government. I told them, look, guys, there is a great opportunity that we can bring something which doesn't exist in our country. So our government said, this is a brilliant opportunity. And they said they liked it. So here with the Deputy Minister of Health in London at the advanced course, I think some of you remember this, who were there, probably Professor Nicola was there. So this was our Deputy Minister presenting on fetal medicine services in Zimbabwe, the opportunity for collaboration. Then our university also said that is a good idea. So the university jumped at the opportunity, and also our hospital institutions, they jumped at the opportunity to support in terms of infrastructure provision, and with the support of our society. So this is the team that went to London. Officials from the Ministry of Health, Professor Nicola is there, and we also had had some partners. This is the team from Pekin Elma, who were also interested in the idea to say how best can they help us, and we had our ambassador from who is in UK, our country ambassador was also there to drum government support, and my two senior colleagues from the university and also from our institutions were also present as a way support, and our neonatologist was also present to support the idea of Fetal Medicine. So that was December 2018. Upon my completion of the fellowship, we said, let's make this happen. Then the second stage was to try and find people with passion. One thing I'd learned during my time in London is that fetal medicine is a discipline of passion. Babies are fairly stubborn, so that if you don't have passion, you'll give up. Sometimes they test your extreme patience when you are scanning them. So I discovered that passion is one of the first criteria that a person should have before they want to practice fetal medicine. Otherwise, you give up on babies, or you would want to take shortcuts. So when I came back, we went into a recruiting drive to say who is interested amongst our obstetric colleagues. And of course, 6 were recruited and 3 to stop along the way because of other interests, and 3 remained. These are some of the colleagues you are witnessing presenting in this meeting. Then we also had a sonographer, one of our specialist sonographers who also presented in this meeting. And we also recruited 2 midwives initially, but we've since now trained 10 midwives who work in our units. We will highlight how much we've trained them in terms of their competency. Then we designed a modular kind of course where we were focusing on people to gain the certain FMF competencies. But because of the demography of our patients that you already saw, that 80% of the patients was being seen in third trimester. So our first focus was to teach our team how to do fetal growth assessment, fetal Dopplers, fetal surveillance. Then we went on to do the fetal anomaly scan after opening the fetal defense clinic, as you had. And we went on now to teach each other fetal defects management after people had mastered all this. Then now we are still in doing the 11 to 13 week scan because we opened this clinic recently. You can see that our numbers are low because most of our women, unfortunately, they do not present this early. Then we did the pre-eclampsia and the preterm birth screening, and also the multiple pregnancy care, which one of my colleagues will present. So with the core team of obstetric specialists and sonographer, we had to travel the world to learn, to improve our knowledge. So this was the team when they went to Congress in Alicante, and we were accompanied by our ZSOG president. You can see the amazing support that is there. So this was our ZSOG president, Dr. Magure, accompanying us there, and this was the team with Professor Nicolaides. So the team has been learning not only on site, but we have also been attending the advanced courses in London during these 2 years of training to try and improve our knowledge of fetal medicine. So basically the training is mainly practical sessions of doing the actual scanning and weekly theoretical courses, which were more of 1 hour Friday meetings that we do. So this is how the training program went. Then we came to the structure where the fetal medicine unit is resident in the obstetric department. What we did is we came up with 2 kind of divisions. We have the routine list clinics, because we do not have dedicated antenatal scanning services in our hospital. So the fetal medicine unit also carries the burden of doing routine scans. So we have these routine scans which are done by our senior and junior registrars, and also our midwives, mainly the midwives we have trained who manage these lists, and supported by the senior and junior registrar as they rotate within the fetal medicine unit, and also the sonographers. They do this list, and the radiographer and sonographer student, they support this routine list. Then we have these specialist clinics that we have created both for clinical care and patient and training. That is the multiple pregnancy clinic, fetal defects clinic, and also the placental disorder clinics, and fetal echocardiography, and preterm surveillance, and the 11 to 13 scan. So this is how we organize the fetal medicine units at the 2 hospitals that we are currently in. And in terms of the staff and the teaching load, these are the people who are in the fetal medicine unit with the fellows, with the senior registrars who rotate, and the SRMOs. Then we also have sonographer students and radiographer students, and we have the midwives and the midwife trainees who are sent to observe and assist, and also the midwife students. The midwife, we are now in a program of continuously training midwives because we want to introduce ultrasound scanning, the labor ward, and also the antenatal clinic so that we reduce the burden of the fetal medicine unit. So we are in an aggressive program of training our midwives. Our goal is not only to set up a training center for ourselves, but we want to create a training hub for Africa, actually. So what we did is we've come up with protocols for the units, that is both for clinical guidance, for case management protocols, and we have also done these protocols for short-term training for basic obstetric ultrasound, advanced. Then we also have got modules for our students, from the radiographer, the medical students, the MED students, and the sonographer students, and also for the fellowship program. We have a fellowship program which has been approved by the university. It's yet to start. So we also have designed a course, a fetal medicine fellowship program, which will be supported by Fetal Medicine Foundation in UK. And these are the different kind of various staff who come to fetal medicine need to be trained at different intervals. Then we went on to set up an infrastructure for research. I think we are aware that research is a very important component in everything that we do. So one of the things that took us time is to try and come up with a patient care database, case notes database. This is the source of our information which we are presenting in this meeting. It took us a long time because we couldn't afford Africa. I think the fact that Africa cannot afford what Europe can afford is clear from the beginning, from Professor Chauka's presentation. So we had to improvise. Upon the advice of Professor Nicolaides, I asked him when I was about to finish my fellowship, I said, how can I go back home and practice what I've been taught? How can I gather data? Because I asked Australia and Viewpoint for their quotation, they were beyond what my government can afford, actually. Then I said, how can I do it? Then he told me, look, I actually told me that Australia, the very big software used in Europe, he is the brain behind it. But what he did was he looked for a software guy and he told him what he wanted to put in a software kind of style. Then I just came home and I did the same. I looked for an IT person and I sat down with him and told him, look, let's make a software that can do A, B, C, D, that allow us to practice, but at the same time generating data for research. So this is the software we came up with and which we use in all our units. These are paperless units which we set up. So we had to improvise and to come up with something of our own that doesn't cost us a lot of money. Then we have since recruited research staff who support our work, who do the data collection, and we've also started writing our protocols for research. It took a lot of time to come up with this. I would have meetings with young people in IT. Some of them would promise me that they can do it and they fail. I almost gave up until the guy who is doing this came along and considered me a blessing. Then after we had set up the fetal medicine unit, I think the problem that has been highlighted from the first presenter is that unfortunately scans are not being done in pregnant women in Africa. So the Ministry of Health, around 2018, they came up with this guideline where they have introduced ultrasound for the first time in our guideline. We never had ultrasound in our guidelines. So they introduced this statement. We said at least one ultrasound scan before 24 weeks of gestation is recommended for pregnant women to estimate gestational age and improve detection of fetal anomalies in matter of pregnancy. So this meant that the ministry to move towards purchasing the machine and training people. And this is where the fetal medicine unit team came into life. So the ministry approached us and told us, look, we have machines and we have a partner with promised machines for all the district hospital and provincial hospital, but we do not have trainers, people who can train. This is where our unit came into being, and we said, look, we can train personnel from all these hospitals from our country. So we embarked on an aggressive training program in 2019 to train staff from the district hospitals. It was a one-week practical course under direct supervision by the fetal medicine team. So we trained the staff targeting the following areas: pregnancy dating, common early and late pregnancy complications, fetal growth assessment, and common fetal defects. So this team of midwives and doctors from the district were trained and were assessed at the end of the training course at their level of competence to be able to work independently. It is an aggressive course, which we did, and this is what we managed to do. We managed to train 66 districts times 2 in terms of the number of staff, because we're training 2, a doctor and a midwife for each of our district hospitals, the same with our provincial hospital. So we trained all of them to the basic skills, including 2 of our central hospitals, which do not have fetal medicine units at the moment in the other second city. And this was possible through the support of these partners. UNICEF supported the training of the district. Fetal Medicine Foundation has been supporting us in training trainers, that is the staff in the fetal medicine units. And these are the images showing our team doing the trainings for our district. We train them in different groups until we managed to train everyone throughout the year of 2019 and 2020. So, and this team of district staff have done an amazing work. And up to date, 25,337 scans have been done by this team. This is a representation of the provinces and some of the centers. Of course, some centers will still need encouragement to do more, but you can see that some are performing very well there. This is a center, one of our provinces, Marsh East, they've done 4,500 scans within a period of a year and a half. This just shows what training people can do. And in terms of support, because the next question is, how are you supporting these people? How are they managing? So what we did is we have created a WhatsApp group of all the obstetric sonographers that we trained, and we've encouraged them to send images and the videos of the cases that they've scanned, of course, hiding patient identity on this group, and ask for questions on how to proceed if they are not sure. So that's an example of a screenshot of one of the recent conversations where one of our colleagues out there scanned the 27-weeker, and they suspected that there could be ventriculomegaly there. So we said, yes, it looks like, refer to PFM, perinatal fetal medicine unit. And some do send videos. We have seen some amazing videos being sent by this team of district and provincial sonographers in obstetrics. So our plan is to expand the fetal medicine service to the other 2 hospitals in the shortest future. Then this has not been possible without partner support. The Fetal Medicine Foundation has helped us by donating 4 high-resolution Volison machines, S10. These are the machines we use in our specialist clinics, and also UNICEF donated 65 ultrasound scan machines for our district to our government. And these partners have played a very key role in enabling us to set fetal medicine services. Then these are the unfolding plans. We are planning to start a fellowship with our university. A lot of paperwork has been done, and we also want to support African centers who want to practice fetal medicine through our local Fetal Medicine Foundation in Zimbabwe organization, of course, in partnership with Fetal Medicine Foundation UK. And we are planning to offer short courses in obstetric ultrasound. We are aware that we have a lot of sonographers, some of them who trained a long time ago in our country, and they need support in certain areas such as Doppler, even first trimester scan, the nuchal scans. They need all that kind of support. And we want to strengthen the research in fetal and women's health in Africa. You will agree with me that the data for Africa is missing as far as fetal medicine is concerned. We want to change that dynamic through our what we have set up. So these are basically the steps that I think we have followed up. First of all, we found passionate people, both our doctors and midwives. They are very passionate about fetal medicine. We had good partner support. We have got good government and local institutions support, including senior staff members. Our professors in our department have been really amazing in supporting us in doing this. We also have got dedicated staff. Fetal medicine is not an easy practice. Scanning babies means you stay at the hospital the longest and you work the hardest. It's not a touch and go field because you have to do the scan to scan babies. We have also managed to establish a clinical service infrastructure with terms of reference and protocols for our obstetric teams who refer patients to the unit. And we have established a training platform for many of our doctors, midwives, and sonographers who want to upskill their skill in obstetric scanning. Then we've also recently completed establishing a research infrastructure for our unit to start some serious research work. So thank you so much for your listening, and I'm very grateful to this all this mentioned here from our government of Zimbabwe, the university, the leadership of our 2 hospitals where we are based, and our Society of Obstetrics and Gynecology, the Fetal Medicine Foundation in UK, and all these other team, including our staff in the Fetal Medicine Unit and those at FMF Zim. Thank you so much.